Hey friends, welcome to my channel, Life with Everyday Haley. I'm super glad that you're here with us. And today I am going to walk you through an update on all of the recurrent pregnancy loss testing that I had done, when I did it, and through which physician I did it. So I just want to share that I have been through extensive testing over the past, 2 months or so. And I really learned a ton about my body and tested for everything under the sun in regards to recurrent pregnancy loss that is advised to be tested for. But again, I'll explain like which test, what the results were. If they were abnormal, I'll just share if anything came up abnormal. And then if you have any questions, let me know. So I'll say before we get started, most everything came back very good for us, husband included. We got great results. And so we were very thankful. And it just gave us reassurance after 2 losses that we can move forward with trying again. And we have learned some things through this testing. So this testing was hard. This testing was exhausting. It was a lot of blood work. It was a lot of time. It was a lot of effort. But you have to fight for your fertility, guys. Fight for yourself. Advocate for your body. The more testing you do, the more reassurance you can have as you move forward. Because as we're aware, it takes a lot of courage to move forward with trying again after multiple losses. All right, so let's get started. So I had some actual pregnancy blood work done prior to my loss. Did my blood work, and then we found out that our pregnancy was not progressing. So I am thankful that I got a lot of this done that day anyway, while I was pregnant, to test for some of these things. And they all came back good. So those were mean cell hemoglobin, red blood cell screening, blood type, chlamydia, hematocrit, hemoglobin A%, hemoglobin A1C level, hemoglobin A2%, hemoglobin F%, hepatitis B, hepatitis C, HIV, mean cell hemoglobin concentration, mean cell volume, mean platelet volume, gonorrhea. She tested my flora in my urine, nucleated red blood cells, nucleated red blood cell ABS, platelets count, let's see, red, like a CBC count, so if I had any type of infection, red blood cells, my RH type auto, that's important for pregnancy, if I have the rubella antibody, syphilis antibodies, white blood cells, and that was it. So that was it for my pregnancy blood work. So I was okay that I still had blood work done, even though I technically, was going to go through a miscarriage. So then I asked them, what other blood work can we do to test for recurrent loss? They told me after 2 we could do recurrent loss testing. And so I took advantage of that. Some people wait till they have a higher number of losses. For me, I found it really traumatic to keep going through loss. And so I wanted to be proactive so that hopefully I don't have to go through this again or for a long period of time. It's emotionally exhausting to go through losses. And so I asked, what else can be done? So I made a follow-up appointment. They wanted me to get through my loss, physically, let my HCG levels go down, and then they wanted me to come back and do like more blood work and have, but let me talk through some of the additional blood work that I've had done. So they scheduled me for some additional blood work with the OB. And then also I contacted my rheumatologist and asked him, what do you think I should look into? Because I do have an autoimmune condition, so we do have to consider that. So my OB tested me for anti-thyroid peroxidase AB level. So those are thyroid antibodies. I was also tested for a thyroglobulin antibody that has something to do with Hashimoto's. And I also asked for my insulin levels to be tested, and that did come back high, which did correlate with my previous issue with insulin resistance and PCOS earlier in life. So again, she really didn't do too many additional blood works on me. Really just checked for some thyroid stuff that can be hormone related. And then I think she didn't test for a couple things because my rheumatologist already did. So let me read you over now what my rheumatologist tested me for in the world of autoimmune. So he tested me for beta 2 glycoprotein, IgG and IgM. Both of those were fine. Diluted Russell Viper venom time. I'd never heard of that before. Let's see. Estimated glomerular filtration rate, lupus antibodies, 52 and 60, so both of those. Partial thromblastin time, low molecular weight, IgG anticardiolipin antibodies and IgM anticardiolipin antibodies, lupus anticoagulant, prothrombin time as well, thyroid stimulating hormone, vitamin D. So again, some of those, I think I'm getting a little mixed up. Some of those may have been ordered by the OB. Some of those were ordered by the rheumatologist. So just know that those tests were either ordered by the OB through my recurrent loss panel or the rheumatologist. I had a lot of them done the same day. So I don't know exactly which provider ordered both of them or which one of them specifically, but all of those are important. So those were the things I had tested at the OB level and the rheumatology level. And nothing came back for anything related to thyroid. Nothing came back for anything related to lupus or antiphospholipid antibody syndrome or blood clotting, nothing. Everything came back great. So I have no signs of blood clotting issues. I have no signs of thyroid issues. High insulin was weird. And then I had polycystic ovaries on the ultrasound. So what I was told at that level from my rheumatologist was we don't see any reason for believing that, you know, you have something autoimmune going on that's causing your losses. He's like, your rheumatology, your RA is doing really good. You're not having flare-ups. It's under control with treatment. So you're green light to go ahead and try to get pregnant again. My OB kind of said the same thing. She was like, you know, we haven't really found anything. Sometimes things are unexplained. And she's like, you know, when you try again, we can supplement with progesterone and do baby aspirin. The typical fixes they try to give you. But I just had a gut feeling. Do you ever feel that way? Because I get pregnant so easily. And to have 2 losses back to back like that, I just felt like something was wrong. And I didn't know if it was related to autoimmune or if there was just something we haven't found. And so I just pressed and something just put it on my heart to keep trying. So I went a step further and got, I guess you could call it a second opinion or further a specialist opinion. So I went to a fertility clinic associated with the health system that I've been going to. And you don't have to have a referral. You can just call and schedule an appointment. Usually, you know, if you have been dealing with, you know, higher level losses, you may get referred to a fertility clinic. That wasn't me. I was just encouraged to keep trying. And then if you tried for longer than like a year, if you're my age, if you're 30, young 20s, 30s, they'll say, you know, try for a year. If you don't have success, they'll send you on, they'll recommend you. So again, you don't have to have a referral for a lot of these. And so I just want to encourage you that if you feel called to do that, do that. So let me go over some of the testing that they did for me at the fertility clinic level. And again, I've been seeing a reproductive endocrinologist. So it was recommended for me to do the chromosome testing. That is the karyotype testing. So that is checking to make sure your chromosomes are good. So when you go to have a child, 50% come from you, 50% come from your spouse. And so we tested mine first. Mine came back normal. We just tested his. So that is the only result we're still pending. We feel like it'll be good, but we just wanted clarity. So if that had come back abnormal for one of us, or if it does for him, then I think IVF is your kind of resolution there, of making sure that you have a good embryo. So let's look at some other things that they tested me for at this clinic. So DHEA sulfate, estradiol level, follicle stimulating hormone, testosterone, thyroglobin antibody, T4 test, progesterone, OH progesterone, sex hormone binding globin, AMH, so anti-Mullerian hormone, and luteinizing hormone, and prolactin. So those are the things that she additionally tested me for related to my hormones and, wanting to see what my cycle blood work was like. So this is where things got a little tricky. So my LH and FSH levels are great, and I obviously ovulate and have normal cycles. So that was unique based on a typical PCOS patient. We didn't expect that all to come back good, but even my testosterone levels were good. So that's my answer as to why I'm getting pregnant so quickly. My blood work looks great. One thing did come back elevated, and that was my egg count. So I have too high of an egg count for my age. It's not terribly high. And I did just turn 30, so I did just jump into that higher age range category. So if you're like up to 29, an AMH of 16 is okay. Mine is 14.5, and I just turned 30. So I'm like, well, I just turned 30, So anyways, what that can mean is that I'm producing too many eggs. And I think it does correlate somehow with the polycystic ovaries and the PCOS side of things. But my doctor was like, that test just accounts for egg quantity, not quality. So again, I am blessed that it's high. It's better high than low. Some women are told, you have a really low egg count, and that's why you're having a hard time getting pregnant. So that's devastating. That's absolutely devastating. And all of this testing is devastating because you put yourself out there and you don't know what your results are going to say. And then you get your results and you have a hard time knowing how to interpret them. It's a lot. Also, to throw this in there, for my husband, the only testing he had done was a semen analysis, and his results came back great. So he got flying colors in his semen analysis. So that answered a lot of our questions too. And the only thing that we saw were polycystic ovaries, a high AMH level, and high insulin. So those three things, along with some symptoms I've had of PCOS in the past, did warrant my PCOS diagnosis. So I am on metformin, and when I do get pregnant again, when we try to get pregnant again, we are going to try an ovulation stimulating drug to try to produce a better egg, and hopefully that will bring me some success. I may not need that, but we're going to try it because it's scary. It's scary to go through this. Okay, and then a few more tests that the fertility clinic wanted me to do. I'd already had the HSG, which is an x-ray procedure to look at the fallopian tubes, make sure fluid flows through them. That I got a 100% great result from that. She did do an ultrasound on me, and she said that everything looked great. I did have a ton of follicles. So a lot of eggs, guys, a lot of eggs. So chances are high for me if I can just figure out what's going on, right? She also recommended that I get a sonohysterogram, which is a saline ultrasound sonogram. And this is a common test done in the realm of recurrent loss workup and HSG as well. So these are in-clinic procedures, more like an outpatient procedure. And painful but quick, and they give you a lot of results. So I did a saline sonogram as well as an endometrial biopsy. So these are my last 2 tests before we're going to try to conceive again. And guys, this is where I did get answers. And let me just say, after going through 3 months of testing, finally getting answers was like shocking. I'm still processing. So if the doctors recommend these tests to you, they're overwhelming, they can be expensive, but there's a reason that they recommend them. So I just want to encourage you. I was really nervous about the endometrial biopsy. I do have a video on my channel of how that procedure went for the sonogram and the biopsy. I also have a video about my HSG if you want to watch that. But just listen to the advice of your doctors. There's a reason they're asking you to be tested for, they're recommending that you be tested for these things. Okay, so the saline sonogram, I had good results. Tubes were open, everything looked normal. Didn't see anything weird. But the biopsy is where I did have a positive result. So an endometrial biopsy looks for inflammation in the innermost uterine lining. And it specifically looks for something called chronic endometritis. So the fertility specialist explained to me that if I have chronic endometritis, it needs to be treated, and it could be a reason for recurrent loss. And I've had back-to-back losses super early, right beside of each other. And I get pregnant so easily that nothing was just making sense for me. Like when I was going through my losses and everything, and I just had a feeling that something wasn't right, but I didn't know what it was. And so that's why I've gone through hell pretty much and all of this testing over the past couple months. So the biopsy, it took about 7 days for those results to come back, and they did a culture of the tissue, and then they did the actual pathology. So the pathology showed chronic endometritis, which means that there is inflammation in the inner lining of my uterus. My results said I had up to 9 plasma cells present. Plasma cells are cells that come in response to like an infection. They're like an immune response. And they're not supposed to be there. Like you're not even supposed to have any plasma cells in your uterus. And so why they want to test people like me that may have had recurrent losses or may have had recurrent implantation failure or with IVF, or may just have struggled with chemical pregnancies or just trying to get pregnant. If you go to a fertility clinic, oftentimes they are testing for this now. I had 2 fertility specialists recommend this test for me over my course of testing. And the weird thing about this is you don't really have symptoms. So one of the only symptoms you can have is recurrent pregnancy loss. And hearing that is hard for me because that's me. And like, I didn't know, and it's just like, oh. And it's so weird. This was our last test that we did through our workup, and it just changed everything. And so my pathology showed 9 plasma cells and chronic endometritis. My tissue from the biopsy showed no bacteria. So no bad bacteria. But the results said rare mixed positive bacteria. So I talked to the doctor. I was like, what does this mean? Like, did they not find infection? Like, what's causing this? And she's like, no, there's something off with the bacteria in your uterus. And they're like, it often comes from your vagina up into your uterus. And she's like, there's no telling how long you had this for. And it can be a prolonged issue. So I think women like me, when they want to get pregnant, they need to think about this. And really the only way to understand you have it is from doing a biopsy. So The good news is it is treatable. There are things they can do to help you and get rid of it, try to clear it. And it's it's it can cause recurrent loss because it creates a hostile environment in your uterus, and it can create early loss or implantation failure because the embryo just can't implant correctly. It can cause inflammation and, just cause the pregnancy to fail. And I think back to my first loss was a chemical, so very consistent with CE. And then my second loss was a missed miscarriage, which everything was progressing really well. And my HCG was progressing. My symptoms were there. Like, we literally were totally shocked when we found out the baby had stopped developing. And I just wonder, was it because of this? I feel like the chances are really high that it was. And so now I'm just praying that we can treat it. So I'm super humbled and thankful that I went through all this testing, because now I can breathe that, okay, I've checked all of this stuff. It's all looking really good. And I also found a potential answer, through the biopsy. So again, my condition is potentially like a disruption, or not just, but bacteria is not balanced. And so it's creating issues in my microbiome or whatever. And so what they've recommended for me is to do antibiotic therapy for 2 weeks. So I'm on doxycycline twice a day for 14 days and Flagyl twice a day for 14 days. They also recommended a Rocephin antibiotic shot in my hip. So I got that today, actually. And I am going to take a probiotic to kind of just help my body rebalance. And they're going to do a biopsy on me in my next menstrual cycle to check things out and to make sure that everything cleared. You want it to clear, because if it clears, then hopefully your environment will be more receptible in your uterus for a healthy pregnancy to grow. So that is kind of the thought process behind chronic endometritis. And again, I just want to share that it's prevalent in a lot of women that have had recurrent pregnancy loss. And it's pretty much a silent killer in a way, because you don't know that you have it. Now, if you followed my channel, I had shared back when I was coming off of birth control that I was having issues with a lot of cramping, and cramping specifically after ovulation and up until my cycle, and luteal phase cramping issues. This could be hormonal. I haven't had my progesterone tested at that end of the cycle yet. But with this diagnosis of CE, I'm wondering if it has something to do with that, with just intense pelvic pain. That seems to have subsided some since last fall. I'm not having as many issues, but they were there. And based on my hormone levels, everything looks pretty good. And then I had shared on my channel through my chemical pregnancy story that after I ovulated that cycle, and I obviously conceived, didn't know it at the time, I just cramped from the moment that I ovulated and conceived until I started spotting, and then I had my loss. So it was intense pelvic pain all through the process of the baby trying to implant, and something clearly went wrong. And so I'm just wondering now, with this diagnosis, was that why I had a chemical pregnancy, and why I was having those struggles. So if you think back, once you get answers, you can kind of think back oh, maybe that's why this, and maybe that's why that. So that's where I'm at right now. A lot. I know that was a lot. So we're done with our testing. We've had a full recurrent pregnancy loss workup, and everything looks really good for me. minus the endometrial biopsy results. So we got to get this CE cleared. I haven't really talked about next steps if it doesn't clear, but I've just been praying for it to clear. And then we will move forward. We have to get his karyotype testing back. And then if that's positive, then we will just move forward with a medicated cycle. And then after ovulation, I'll start prometrium and baby aspirin. So we will pray that we have a successful pregnancy next time. So again, if you're going through recurrent loss, it's so hard. I hope this video helps you just know what I was tested for, results I received. Every person will be different. Every test result will be different. The good thing about going through a recurrent pregnancy loss workup is you find answers. And I think for a lot of people, there's a reason that you're having recurrent pregnancy loss. You know, it's only 1% of people. And I think that there's probably a reason underneath there. And just know that this testing is not cheap. I've been blessed that my insurance has covered a lot of this testing. And with my, I made sure to pick a physician that was in my network with my insurance so that I could get all of this stuff done under them and it wouldn't be breaking the bank. If you have to do this without insurance, just be prepared. Thousands of dollars. I have done thousands of dollars of testing. And just think of it as an investment for your future and you trying to do what you can to grow your family. So thank you for watching this video on my recurrent pregnancy loss testing, what I had done, where I'm at now, and where we move forward. So I'll keep you updated with upcoming videos on our progress. I'm really thankful that I got some answers. I feel like I'm in a much better place now than where I was back with my last loss in January. But it doesn't make it any easier. And I've had to really just press and push myself. But I'm glad that I did because I got a lot of stuff done that I need to get done. So thank you for watching. If you have any questions or comments, please send them to me below. And I wish you the best of luck on your fertility journey. Y'all have a great day.